I want you to do something before we go any further. Hold out one of your hands and look at your fingernails. Really look at them, not at the polish or the length. Look at the actual nail, the color, the surface, the small white half-moon shape at the base, if it is still there, the lines, if there are any. Most people look at their nails and see nothing remarkable, just nails. But doctors trained in vascular medicine, cardiology, and internal medicine look at fingernails and see something completely different. They see a window, a direct, visible reflection of what the blood is doing deep inside the body in the vessels, the heart, the peripheral circulation. Your fingernails grow from something called the nail matrix, a small piece of living tissue at the base of each nail that is entirely dependent on blood supply to function. Every cell in your nail was built by blood. Its color, its growth rate, its texture, its shape, all of it reflects the quality and consistency of the circulation that fed it. This means your nails have been quietly keeping a record of your cardiovascular health, your circulation, your oxygen levels, and in some cases your organ function, written in a language that most people have never been taught to read. Today I am going to teach you that language. I am going to show you 6 specific things to look for in your own nails, what each one means, how serious it is, and what to do about it. Some of what I show you will be reassuring. Some of it may prompt you to make a phone call to your doctor. Either way, you will leave this video knowing something about your body that most people never learn. Keep your hand out. We are going to do this together. Section 2: Why nails reflect circulation. Before we go through the 6 signs, I want to give you a brief explanation of why nails reflect circulation so accurately, because once you understand the mechanism, the signs we look for will make complete sense. Your nail matrix, the tissue that grows your nail, sits at the base of each finger, just beneath the skin at the bottom of your nail. It is one of the most blood-dependent tissues in the entire body. It needs a constant, rich supply of oxygenated blood to produce new nail cells. When that supply is reduced even slightly, even gradually, the quality of the nail that grows changes. Think of it like a factory that is running on reduced power. The output becomes different, slower, less consistent. The product shows signs of the reduced resources. Fingernails grow at approximately 3 millimeters per month in healthy adults. As we age and as circulation changes, this rate slows. A fingernail that now takes 6 weeks to grow what it once grew in 4 weeks is reflecting a measurable reduction in blood supply to the nail matrix. Toenails grow even more slowly, about 1 millimeter per month, and they receive circulation from even further away. This is why toenail changes are often more pronounced in people with circulation issues than fingernail changes. If you have noticed your toenails thickening, growing more slowly, or discoloring, pay close attention to what we discussed today. Beyond growth rate, the nail also reflects the chemical composition of the blood, its oxygen content, its iron levels, its protein availability. Different deficiencies and circulatory problems leave different visible signatures on the nail. Doctors have been reading these signatures for over 100 years. Emergency paramedics are trained to look at fingernail color and capillary refill as a rapid assessment of a patient's circulatory status. It is not folk medicine. It is standard clinical practice. Now let us look at the 6 signs, starting with the one that concerns me most when I see it. Section 3, Sign 1, Lunula, and Sign 2, Capillary Refill. Sign number 1, the disappearing lunula. Look at the base of your thumbnail. You should see a small white half-moon shaped area. This is called the lunula, from the Latin word for moon. It is the visible part of the nail matrix, the living tissue that grows your nail. In a healthy person with good circulation, the lunula is visible on most fingers, prominently on the thumbs, and at least faintly on the index and middle fingers. Now here is what I want you to check. Look at your pinky finger. Look at your ring finger. Is there a lunula there? In many people with reduced peripheral circulation, the lunula shrinks or disappears entirely on the smaller fingers first. The nail matrix at those fingers is receiving less blood, producing fewer new cells, and the visible evidence of that process, the lunula, becomes smaller or vanishes. A single missing lunula on one pinky finger is not necessarily significant, but if multiple fingers, 3, 4, or all of them, show no visible lunula, that pattern is worth discussing with your doctor. Research published in the Indian Journal of Dermatology links the absence of lunulae across multiple digits to reduced microvascular circulation. If you can still see your lunulas clearly on most fingers, that is a good sign. Your peripheral circulation to those nail matrices is active. Sign number 2, the capillary refill test. This is the test that paramedics use at accident scenes to assess circulation in seconds, and you can do it right now. Press firmly on the flat surface of one of your fingernails with your thumb. Press hard enough that the nail turns white. You are compressing the blood out of the tiny capillaries under the nail. Now release the pressure and watch. Count the seconds until the nail returns to its normal pink color. In a healthy adult with good circulation, that color should return in under 2 seconds. Under 2 seconds is normal. If it takes 3 seconds, that is borderline. If it takes 4 or 5 seconds or longer, that indicates that blood is having difficulty returning to that capillary bed. That is a sign of reduced peripheral circulation. Worth paying attention to. This is called capillary refill time. It is documented in the British Journal of Anesthesia as one of the most reliable bedside indicators of peripheral perfusion, meaning how well blood is reaching the extremities. Test all 10 fingers if you can. Pay particular attention to whether your toes take longer than your fingers. That difference in timing tells you where circulation is most compromised. Section for sign 3, ridges, and sign 4, nail color. Sign number 3, vertical ridges. Run your finger across the surface of one of your nails from the base to the tip. Feel for ridges, lines running from the cuticle toward the tip of the nail. Some vertical ridging is entirely normal after 60. The nail matrix, like all tissues, changes with age, and fine vertical lines are common and generally not a concern on their own. But here is what matters: the rate of change and the depth. If the ridges you are feeling now are noticeably deeper or more numerous than they were 1 or 2 years ago, that acceleration is more significant than the ridges themselves. Rapidly deepening vertical ridges are associated in dermatological research with declining microcirculation to the nail matrix and with conditions including peripheral artery disease and arterial stiffness. Also look for what is called onychorexis nails that split vertically along these ridges, or nails that have a rough, almost sandpaper-like surface when you run your fingernail across them. This pattern specifically has been linked to iron deficiency and reduced red blood cell production, both of which directly affect the oxygen carrying capacity of the blood and therefore the health of peripheral circulation. Sign number 4, nail color changes. This is one of the most important signs and one of the most commonly overlooked because people attribute color changes to cold temperatures, to nail polish staining, or simply to aging. Look carefully at the color of your nails in good light. Natural light is best for this. Healthy nails should be a soft, consistent pink, slightly translucent, reflecting the healthy pink tissue and good circulation beneath. Pale or white nails. If your nails appear very pale, significantly lighter than the surrounding skin, this can indicate reduced red blood cell count, meaning your blood is carrying less oxygen than it should be. This is called nail pallor, and it is a clinical sign of anemia. Anemia in older adults is directly connected to reduced oxygen delivery throughout the body, including to the peripheral circulation. Bluish or purple tint. If you notice a bluish or purplish tint at the tips of your nails or underneath the nail itself, this is called cyanosis, and it indicates that the blood reaching those extremities is low in oxygen. It is one of the more serious signs on this list, and it warrants a prompt conversation with your doctor. Yellow nails. Yellow coloring in nails, particularly if the nails have also become thicker or slower growing, can indicate lymphatic circulation issues. The lymphatic system runs parallel to the blood circulation system and is responsible for clearing fluid and waste from tissues. When it is compromised, fluid can accumulate and nails can yellow and thicken over time. Any significant change in nail color that persists and is not explained by nail polish or a recent injury should be discussed with your doctor. Color is one of the fastest signals the nail gives because it directly reflects the oxygenation of the blood flowing to it right now. Section 5, sign 5, Bowes lines, and sign 6, growth. Rate. Sign number 5, Bowes lines. Look at your nails again. This time, look for horizontal lines, ridges, or grooves running across the nail from side to side, perpendicular to the direction of growth. These are called Bowes lines, and they are not a sign of current circulation problems. They are a record of past ones. When the body experiences significant physiological stress, a serious illness, a major surgery, a severe nutritional deficiency, or a significant disruption in circulation, the nail matrix temporarily slows or stops production. When it starts again, a visible groove forms at that point in the nail. As the nail grows, that groove moves toward the tip of the nail. Because nails grow at approximately 3 millimeters per month, you can actually calculate roughly when the disruption occurred. A Bowes line that is halfway down the nail, about halfway between the cuticle and the tip, occurred approximately 5 months ago. A line near the tip happened close to 10 months ago. If you can see Bowes lines on multiple nails simultaneously, meaning the same groove appears at the same relative position on several fingers, that tells you the disruption was systemic. It affected the whole body at once, not just one nail. A serious illness, a cardiac event, a significant drop in blood pressure or circulation. For an extended period. Bowes lines on a single nail usually indicate a local injury or trauma to that specific finger. Bowes lines across multiple nails simultaneously indicate something the whole body went through. If you see multiple simultaneous Bowes lines and cannot identify an obvious cause, that is worth mentioning to your doctor. Sign number 6, nail growth rate comparison. This final test requires a small amount of observation over time, but it is remarkably informative. Starting this week, mark the base of one fingernail just above the cuticle with a tiny dot of nail polish or a marker. Measure the distance from the cuticle to that dot in millimeters. Write it down with the date in 4 weeks. Measure again. How far has the nail grown? Healthy fingernail growth is approximately 3 millimeters per month, or about 3/4 of a millimeter per week. Significantly slower growth indicates reduced blood supply to the nail matrix. Now do the same thing with a toenail. Compare the growth rates between your fingernails and toenails and between your dominant and non-dominant hand. If your toenails are growing at less than half the rate of your fingernails, that disproportionate difference suggests that circulation to the feet is significantly more compromised than to the hands. This is valuable information about where in your vascular system the most significant changes are occurring. Keep that record. Bring it to your next doctor's appointment. Most doctors will find it genuinely useful. It is the kind of longitudinal observation that a brief clinic appointment rarely captures. Section 6 WH82. Now that you know what to look for, let me give you a clear framework for what to do with what you find. If you found no significant signs, your capillary refill was under 2 seconds, your lunulas are visible, your nail color is consistently pink, no Bose lines across multiple nails, that is genuinely good news, your peripheral circulation is doing its job, continue the habits that support it: staying active, staying hydrated, eating adequate protein, and avoiding prolonged sitting. If you found 1 or 2 mild signs, perhaps slightly slow capillary refill or faint vertical ridges that have been there for years, these are worth monitoring but are not necessarily alarming. Start the contrast therapy protocol I described in my previous video to improve peripheral circulation. Recheck in 6 weeks. If you found 3 or more signs, particularly if you noticed pale nails, a bluish tint, very slow capillary refill over 4 seconds, Bose lines across multiple nails simultaneously, or a significant and recent change in nail color, please schedule an appointment with your doctor and mention specifically what you observed. Tell them you noticed changes in your nails and you want your peripheral circulation and blood oxygen levels checked. You are not being alarmist. You are being observant. These are clinical signs that doctors are trained to look for. You are simply presenting them with what you found in the same way you would describe any other symptom. There are a few things that can significantly improve nail and peripheral circulation health over time. Adequate protein intake, at least 1.2 grams per kilogram of body weight per day, gives the nail matrix the building blocks it needs to produce healthy nail cells. Iron levels, checked through a simple blood test, are frequently low in older adults and directly affect nail quality and circulation. Supporting habits, the contrast therapy, the calf exercises, avoiding prolonged sitting all improve the blood supply that the nail matrix depends on. Your nails did not change overnight, and they will not improve overnight, but the changes are visible over weeks and months, which is what makes this ongoing self-monitoring so valuable. Section 7, Real Story. I want to share something that happened that I think illustrates why this matters more than it might seem. A man named David, 63 years old, came to me not because of his nails. He came because he was experiencing fatigue, persistent, unexplained fatigue that had been gradually worsening over about 8 months. His routine blood tests had come back largely normal. His doctor had told him it was likely stress or poor sleep. As part of my assessment, I asked him to hold out his hands. His capillary refill on 3 fingers was over 4 seconds. His nails on both hands were noticeably pale. 2 of his fingers showed faint but present Bose lines at the same relative position, suggesting a systemic disruption approximately 7 months earlier. I asked him when the fatigue had started. He said about 8 months ago. I asked him if anything had happened around that time: illness, a stressful period, any physical event. He thought about it and remembered that he had had a severe flu, unusually severe, about 8 months ago. He had been in bed for nearly 2 weeks. He had recovered but never quite fully regained his energy. The Bose lines were recording exactly that event. The pale nails and slow capillary refill were showing that his peripheral circulation had not fully recovered, with that picture confirmed by a subsequent blood test showing mild anemia. His doctor adjusted his treatment, targeted iron supplementation, and a circulation protocol. Within 3 months, his energy had measurably improved. David told me afterward that he had looked at his nails every morning for 63 years and never once thought they were telling him anything. They had been trying to tell him something for 8 months. That is what I want you to take from this video. Your nails are communicating, and now you know how to listen. Section 8. Close. Let me bring everything together before we finish. Your fingernails are not decorative. They are a living record built cell by cell from the blood supply that reached your nail matrix, carrying with it information about your circulation, your oxygen levels, your nutritional status, and your cardiovascular health. We looked at 6 signs today: the lunula, its presence or absence, the capillary refill test and the 2-second benchmark, vertical ridges and what rapid deepening means, nail color, pale, blue, and yellow, each telling a different story, Bose lines, the record of past systemic disruptions, and nail growth rate and what it tells you about where circulation is most compromised. None of these signs alone is a diagnosis. Together, they are a picture, and pictures are worth paying attention to. I encourage you to do 2 things after this video. First, check all 6 signs today, right now, while the information is fresh. Write down what you find. Second, set a reminder in your phone for 6 weeks from now. Check again. Compare. If you found something today that concerns you, please talk to your doctor. Bring your notes. You are not overreacting. You are being an informed, attentive patient. That is exactly what your health needs you to be. Share this video with someone who looks at their nails every day without knowing what they are looking at. You might give them something genuinely important. Now in my next video, I want to show you something that happens to your body every single night between 4 and 6 in the morning while you sleep, while you feel completely safe and unaware, something that is quietly affecting your muscles, your heart, and your energy, and that almost no one has ever connected to sleep before. The research behind it stopped me in my tracks when I first read it. The link is right here. I will see you there.